It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right. Our first guest is Dr. Rebekah Lay, a physical therapist and clinic director with South Sound Physical Therapy in Tacoma, IRG's affiliate, talking about her clinic, conditions that are being treated with both women and men as far as their health is concerned. And Shannon, sounds like Dr. Lay has been doing a great job in conjunction with you guys through the STAR Clinic, right?
Yeah, absolutely. STAR Physical Therapy right there in Tacoma. And Rebekah is awesome. She's our clinic director there, but she's awesome in a number of different ways. Her energy, her passion, her enthusiasm are fantastic. She also has a specialty training in treating men's and women's health issues, which are out there, and they're sometimes difficult for patients to talk about. But these specialty services that IRG provides, we cover everybody. We'd like to say we have you covered, Tom.
I like it. All right, here's Dr. Lay and Shannon O'Kelly.
Rebekah, welcome to Health Talk. How are you?
Good, Shannon. Good morning. Thank you for having me.
Well, thank you for joining us. As Tom Hutler mentioned in the introduction, you're a clinical director at our STAR Physical Therapy Clinic in Tacoma. But more importantly, we want to talk to you about your subspecialty area, if we can call it a kind of a subspecialty area. And I think the general public, what we're trying to do here is educate the general public regarding physical therapy services, but more importantly, the specialty training and the specialty care that some therapists can provide. And one of your areas of interest is women and men's health. Tell us about your practice, your training, kind of your background, and your interest in women and men's health, okay?
Sure, that would be great, yes. So probably about 10 years ago, I started my training in the pelvic floor specialty, and it followed after having undergone the orthopedic board certification, and some training with another institute up in Canada called NIOMT. I wanted to expand. I wanted to do more in orthopedics, and specialties just kind of grabbed my attention. So I started developing 3 specialties pretty much at the same time. Pelvic floor was one of them. Pelvic floor really spoke to me because the nature of it was so sensitive, and it was very gratifying to provide answers for people for things that were very difficult for them to find care for. So following this, I fell in love with it more and more as time went by. I eventually got on with surgical practice, and I was with them for just shy of 8 years. And finally, I joined IRG. So now I'm ready to bring this practice into another county. Literally, I was up in Issaquah. Now I'm in Tacoma.
Well, Rebekah, we're glad to have you here at IRG. And more importantly, I think one of the things that as I'm listening to you, it's really important. I've talked to several patients over the years, and patients don't really understand what women's health and men's health is. And you mentioned pelvic floor. And, there is treatment options out there, and some people just sit and they don't know what choice they can make and what direction they can take. And the specialty training that physical therapists have is very unique, particularly when it comes to women's and men's health. Let's talk anatomically about the pelvic floor. I don't think people appreciate the muscular connection and how it functions. It's kind of complicated, but I think we should give it its due service and talk about anatomical relationship to the whole function of the pelvic floor.
Yes, absolutely. So if you're listening to the radio, you're probably in your car driving. If so, you're sitting. You are sitting on your pelvic floor. Your pelvic floor is literally the bottom part of your pelvis. Your pelvis looks like a bowl. If you were to take the spine off of the pelvis and the hip joints off of the legs, off of the pelvis, you would see a bowl. The bottom part of it is vacant. There's nothing there. The muscles of the pelvic floor are what line that whole arena. They offer support to the end component of the entire chamber, or 2 chambers: your abdominal chamber, your thoracic cavity, your pelvic cavity, and it's kind of a spring load that offsets the diaphragm, the respiratory diaphragm. You can also think of the pelvic floor as faucets. When you turn your hot water on, you turn it off. You turn your cold water on, you turn it off. Your pelvic floor is layered with various sphincters that govern the bladder and the bowel.
Wow, that is a fantastic explanation. I'm just thinking as we're talking, just remember, people, when you're up walking around, that bowl, gravity is pushing all those internal organs and everything, and wants to push it down. And that bowl, that muscular bowl that you call your pelvic floor, is supporting those. And then you describe the sphincters, the faucets. So important to understand that, particularly when we start talking about urinary incontinence and different problems that occur down there. We're going to take a real quick break here, Rebekah. We're going to come back, and we're going to talk about specifically the things that you can treat but this is really good information. I know our listeners are appreciating it.
Excellent.
More with Dr. Rebekah Lay and Shannon O'Kelly next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Rebekah Lay and Shannon O'Kelly on Como.
Rebekah, again, thanks for joining us here on Health Talk. Boy, I tell you, you've got a lot of training. As I listened to your first segment, I really can appreciate all the specialty training you have, particularly when it comes to a complicated area and discussion topic such as women's and men's health. You described it perfectly. You set it up anatomically as a bowl. You talked about sphincters. But I guess we need to talk about what kind of things can you treat and what kind of things do you see related to pelvic floor dysfunction?
Absolutely. There's a lot of misunderstanding of what kind of conditions involve the pelvic floor. And I first want to say that my targeted population is both men and women in ages 18 and up. It's surprising to find out that, as young as 10, I did treat 10-year-olds and up back in the day, can have all the conditions that I'm about to mention. And one of the things that seems clear to the public is that, while this isn't really talked about in their general practitioner appointments, there's not a lot of screening for conditions that affect the Netherlands, is that none of these conditions are normal. They're not acceptable as far as those of us in the specialty feel. And they can affect both genders and pretty much all age. So in broader categories, I treat urinary, bowel, sexual dysfunction, and chronic pain conditions. But if we were to break down the urinary just a little bit, there's urinary incontinence or leakage, frequency, urgency, bladder retention, bladder pain, painful urination, getting up at night to urinate. For the bowel, I see a lot of pain with bowel movements, constipation, and of course, leakage, fecal incontinence. As far as sexual dysfunction goes, painful intercourse, pain with arousal, pain with orgasm, these sort of things. Chronic pains can follow many, many people. They're very difficult to treat in isolation without looking at the pelvic floor is oftentimes the predominant common denominator to chronic pelvic pain. And also some specialty areas. I really enjoy working with clients who have endometriosis and related aches and pains in the pelvic region and abdominal region as well. On occasion, I do see unresolved low back pain and hip pain that just does not come around well in traditional physical therapy. So those in a nutshell: urinary, bowel, sexual dysfunction, and chronic pain.
So you're kind of this detective down there in the lower portion of the anatomy. So, I mean, it's very interesting. It's very complicated, very interesting. And the thing that I find that I think we need to let people know is there's help for you. In a professional's hands like yourself, these are easy things sometimes to provide some resolution of symptoms and create some quality and functional life that everybody deserves.
Absolutely, that's right. I think when I'm meeting clients for the first time and I can see they're squeamish, they're nervous, they're uncomfortable, my number one thing right straight out the gate is to normalize what they're going through and assure them that this is extremely common.
Right.
They're not alone whatsoever.
Remember, people, you're not alone, and this can be treated, and we can help you in physical therapy, in women's and men's health care. Thank you, Rebekah.
Yes, thank you so much, Sean.
You've been listening to Dr. Rebekah Lay, physical therapist and clinic director with South Sound Physical Therapy, the Star Clinic in Tacoma, an IRG affiliate. More information at southsoundtherapy.com. And it's great that she's covering both men's and women's health, Shannon, because there's, especially during the COVID era, a lot of us that need that attention.
Yeah, and I think the important thing here is people need to understand that physical therapists have significant specialty training and can provide specialty care for issues like men's and women's health, which is a resource for a lot of people that have these problems.
All right. Our next guest, Dr. Ryan Hudson, joins us right after this time out on Como.